Hi, I'm Dr. Christopher Van Tilburg, Public Health Officer, Hood River County. I want to talk about testing today. Most of the tests done in the country are a PCR test for COVID-19, and this technical term is called a polymerase chain reaction. It basically identifies the presence of the genetic material of the virus. And it's important to know that these tests are about 75% sensitive pretty much throughout the country, pretty much in all labs. So what the sensitivity is a medical term for the total number of positive tests divided by the total number of people you tested that actually have the disease. So, and in this case, the sensitivity is 75%. So what that means is if you have 100 people with COVID and you test all of them, 75% will turn positive and 25% will be negative, and that means 25% of the people actually have it who are tested are negative. So the importance here is even if somebody tests negative, they still may have the disease and they still may be a carrier. And so that's really important. I've had some questions about the blood tests. We don't have the blood tests in Hood River County because nobody in the country has the blood tests right now. So that's being worked on right now with the CDC and various labs. What the blood test is it's also called serology, or it's also called an antibody test. And so what the blood test does for COVID-19 is it detects antibodies that your immune system is made to combat the disease. And so there's two antibodies it searches for. The first one is present about 7 to 10 days roughly after you've contracted COVID. And so it's not really useful to identify acute onset. The second antibody is present for more long-term, and it's considered a marker for immunity to COVID. So the important thing that I want everybody to know with the blood test is that, first of all, we don't know how long immunity lasts, if it lasts at all, okay? And different diseases have different immunity durations. For example, if you get a measles immunization, the immunity doesn't last forever, and we know that you need a second measles booster to have lifelong immunity. And so in this case, we don't know how long COVID immunity may or may not last. The second issue is we know that all of the coronaviruses mutate. Similarly, the flu virus mutates, and so we don't know if you're infected with COVID now, if you'll have immunity in October, for example. And this is why you get a flu shot every year, because the flu shot mutates from year to year, and so you need an updated vaccine every year. Okay, we've had some questions about stats for the health department. We are not producing any stats because we don't have the ability to duplicate or the desire to duplicate what's already being done. So the state of Oregon Health Authority keeps track of stats. I'll post their website here, and you can see how many tests are done in Oregon. You can see how many tests are done in Hood River County, and you can see that we have 2 positive tests in Hood River County. And if that's useful information for you, I'll direct you to the state website. The important thing to know there is that all labs, there's a lot of different labs testing. There's private labs, there's hospital-based labs, there's a state lab, and the turnaround time, from what I've heard, varies between 24 hours and 7 days. Okay, finally, who needs a test and where do you get the test? We are really encouraging people to talk to their primary care provider. All of the primary care providers in Hood River are either doing tests or they know how to get a test. I host a weekly call with all of the private providers and allied health professionals in the community. And I think last week we had close to 100 people call in, and so we are all communicating. And if you need a test, contact your primary care provider. The health department doesn't do testing. We can facilitate testing for people who are to turn positive in a congregate setting, such as in a nursing home, if that happens. Tomorrow I'm going to talk about cloth face masks and cloth face coverings. Thank you very much. Be safe.